Good morning. Today what we are going to do is swelling, which is called as the lipoma, and this is obviously a drill exercise, part 5 being continued. Just to revise, whenever an examiner is going to come to you during your examination, he is going to ask you following questions. Describe your clinical finding. What is your diagnosis? Justify your diagnosis. How will you confirm the diagnosis? What is the treatment? Why do you want to operate? What are the complications of the swelling? Obviously, in addition to these, he might ask few questions which are relevant to the swelling. In this case, that's lipoma. Now, if you see this thing, this is a picture of the patient lesion, and as you see, this is a lipoma. A lipoma is a cluster of fat cells which have become overactive and so distended with fat cells that they have become palpable lumps. That is what a lipoma is. Now, we are going to do a role play, and the examiner is going to ask me to examine the patient. So let's see when the examiner comes.
This is the patient. Kindly examine it, and then when you're ready, let me know.
Good morning, ma'am. Sure. First, I must introduce myself to the patient. I am Dr. Irfan, and what is your name? And after this thing, then I should take history, and history, important thing is her age, and then it's the swelling. So I should ask him that when did he first noticed it, and what brought his attention to the swelling? How the swelling has progressed? Has he received any treatment or not? What problem does the swelling cause? And what does he in fact thinks of it? And after that, when I'm going to examine this patient, I'm going to see its site, its size, its shape, its surface, its edge, its consistency, then fluctuation test, transillumination test, compressibility, reducibility, bruit, and obviously this is a swelling in the limb, so I have to see the axillary lymph nodes, and I have to also check the distal neurovascular status. Okay, does it have any effect or not? So I've asked these questions to the student, to the patient, and I have examined the patient also. So let's see when the examiner comes now.
Okay, are you ready?
Yes, ma'am, I am ready.
Okay, describe your clinical findings.
Well, ma'am, this is a young patient, and he noticed this swelling a few years ago, and in fact it was brought to his notice by his wife. And this swelling is gradually increasing in size, and it does not cause much symptoms to him. But he says that when he is wearing shirts, sometimes the sleeve is difficult to put on a sleeve when he is wearing fit clothes. Other than that, it doesn't cause any symptoms. He is not worried that much, but he says this thing, his wife and other people, they always pointed out, okay, it is anxiety, and that sometimes causes embarrassment to him. And in addition to this, similar swelling, he has noticed 2 more swellings, one in his right arm and other also in the right forearm. When I examine this patient has a swelling, and swelling is present in the upper limb, dorsal surface of the forearm. It is spherical in shape, approximately 3 cm in diameter, and its surface is smooth, and it appears to be slightly lobulated on inspection, and it's non-tender. And when I felt the swelling, then it was of soft consistency. Its edges are slightly curved, and if you see its skin, the color of skin is normal, and temperature over the swelling is same as elsewhere. Although it is soft, but when I pressed it firmly, I could feel lobulations on the surface. Slip sign is present. It is not fluctuant. It is not transluminant. It is not attached to the overlying skin. It is not attached to the underlying muscle, and it is freely mobile in the subcutaneous tissue. Axial lymph nodes are not enlarged, they are normal, and surrounding skin is also normal, and neurovascular status is intact.
Okay, what is your diagnosis?
My diagnosis is that it is a lipoma,
Justify your diagnosis.
because this swelling appears to rise from the subcutaneous tissue, and it has diagnostic signs of lipoma. Slip sign is present and lobulation is present. This is so because when I was feeling this swelling, it was firm, it was soft, but it was so mobile that sometimes I felt that it has slipped under my finger when I pressed it. And when I put a pressure on it, the lobulations, they were quite apparent to me.
How can you say it is in the subcutaneous tissue?
Oh, well, ma'am, you see, I could pinch my skin, his skin over the swelling. It means it was not attached to the skin. And when I contracted the underlying muscles of the forearm, which I flexed them, then this swelling became more prominent, in fact. And it was not attached to the muscle, as it was freely mobile in all directions, even when the muscle was contracted.
How will you confirm your diagnosis?
By fine needle aspiration cytology, that is helpful in confirming the diagnosis.
What is the treatment?
The treatment is excision under local anesthesia.
Why do you want to operate?
I want to operate in this patient is because the patient says he has a problem. The problem he says is wearing clothes which are important to him, and obviously everyone has. And other thing is it is anxiety, and it causes embarrassing situations to her when people start asking questions, because someone nowadays, whenever he wears this half sleeve clothes.
What are the complications?
As a matter of fact, lipoma does not causes much complications, and it doesn't have usually any symptoms also.
Okay, can it become malignant, a sarcoma?
No, ma'am. Lipomas, they never become malignant. In fact, liposarcomas, they are liposarcoma from the very beginning, and they are de novo.
Which lipomatous swelling you may consider to be a liposarcoma?
Well, if a swelling is large and much larger than 5 centimeter, and especially if the swelling is present in the trunk or it is present at the back, in the retroperitoneal tissue, and the swelling is also giving history of enlargement, not sudden enlargement or showing increased enlargement, because lipomas, they go very, very slowly, then I might suspect that that could be a liposarcoma.
How will you investigate if you are suspecting it to be a sarcoma?
I am going to follow the general principle of sarcomas, which is everywhere. That is, we don't do a biopsy of a sarcoma first. The first investigation is MRI, magnetic resonance imaging, because important thing in the treatment of sarcoma is its excision. And the extent of excision, one important tool we have to decide is the MRI. So therefore, if we take a biopsy first, then it affects the image of MRI. So therefore, MRI is to be done first whenever we suspect any sarcomatous growth.
Is he suffering from multiple lipomatosis?
No, ma'am, because he has few lipomas. In multiple lipomas, the lipomas are many, and if you think of it, looks like in such cases as if they're usually present in the limbs are studded with lipomas. and they are in such patients of all shapes and all sizes. And in multiple lipomatosis, many times these lipomas could be painful also. And not only this thing, many times when you look closely at them, well, on the skin it won't be visible, but on histopathology, once you do find them that they have vascular element in them also, which is not visible when you actually see them because they are covered by skin. At those times, they are also called as angiolipomas.
Okay. What is the other name for it?
Other name of multiple lipomatosis, which is usually painful also, is Dercum's disease.
Thank you. Thank you very much.
Thank you very much, ma'am. I hope this helps you in understanding lipomas. So have a good day. Thank you very much.